Digital medicine, diagnostics and assessment. Anybody who's over the age of 50, certainly my sort of age, will remember the family doctor and the little black bag. They also probably have fond memories of family doctor visits to your home and going to the doctor's surgery, the doctor's little brown bag with the stethoscope and thermometer, the weigh scales in the surgery and the little Rolodex files with all the medical history of you and your family. Of course, in the last 50 years, life has changed enormously. It's now very difficult to get appointments with the doctor, especially in these days of coronavirus. But importantly, the technologies that are being used today for medical diagnostics and assessment have been very strongly impacted by the advent of digital technologies. Now, the important thing is that the vital signs that are being measured have changed very little in those last 50 years. Even though the technology has changed, the vital signs that are being measured still measure temperature, they measure blood pressure, we measure weight, and we also rely on a conversation with the doctor to understand our condition. And of course, our medical history is extremely important, and in those early days that was all based on handwritten cards. So what's happened in the last 50 years and how is that going to impact the future of healthcare? Well, digital technologies and more importantly the consumerization of digital technologies has had an enormous impact, because the technologies that are used today, whether it's within a hospital environment where you're being continuously measured, or if it's in a home environment where the doctor pays a visit, or today there are a variety of different tools that you can use to measure your own health. And the number of people like myself wearing Fitbit to measure our heart rate, our sleep, many of the things that doctors rely on for their diagnosis, we are already capturing ourselves. So it raises a big question as to who is responsible for our health, what kind of records are being kept, and how is that information going to be useful to us as individuals and to public health services as a whole. Well, there are many challenges, many different opportunities, and it's becoming increasingly important, particularly today with coronavirus, that people do take more responsibility for their own personal health. So we're going to be looking at a variety of different tools, technologies and devices used to measure personal health, and we're going to be looking at the impact that's going to have on the medical profession, our relationship with doctors, and our reliance on technology for diagnosis and assessment. Exciting times indeed.